Hi, my name is Dr. Becker. Getting a mastectomy is a very scary and unfamiliar experience for so many women. Even if you have gone through other surgeries before, this one feels different in ways that are hard to describe until you face it yourself. The good news is that with the right information and preparation, you can make your recovery smoother, reduce discomfort, and return to your daily life with greater confidence and less frustration. Today, I want to share with you 12 important insights about mastectomy that many women wish they had known ahead of time. These are the practical details that often get overlooked in standard medical conversations, and I am sharing them here because knowledge truly is power during this journey. One of the first and most empowering realizations is that you are in the driver's seat when it comes to your treatment decisions. You have meaningful choices available to you, and it is essential to explore all of them carefully with your medical team. For reconstruction, options include implants or autologous tissue procedures such as the DIEP flap, where surgeons use your own abdominal fat and tissue to create a natural-looking breast mound. Some women decide to forego reconstruction entirely and choose what is often called going flat or flat closure. Each path has its own advantages depending on your body, lifestyle, health goals, and personal values. It is important to understand the realities of implants. The FDA has noted that women with certain textured breast implants carry a low but real risk of developing a rare condition called breast implant-associated anaplastic large cell lymphoma, or BIA-ALCL. While the overall risk remains very small, roughly 1 in 30,000 for those with textured implants, the treatment, if it occurs, usually involves removal of the implant and surrounding tissue, sometimes followed by chemotherapy or radiation. For many women who are already facing breast cancer, the idea of introducing even a small additional cancer risk feels overwhelming. That is completely understandable. Breast implants are generally considered safe for the vast majority of patients, yet some women prefer to avoid them and lean toward using their own body tissue or choosing no reconstruction at all. The DIEP flap procedure, for example, relocates skin, fat, and blood vessels from the lower abdomen to the chest area. It creates a soft, natural result that can feel more like your own body, but it is a longer and more complex operation. Not every hospital or surgeon offers this advanced technique, and the recovery involves healing both the chest and the abdominal donor site, which means a more extended healing timeline compared to implants or flat closure. Going flat is gaining more acceptance and visibility in the breast cancer community. Many women report feeling strong, confident, and whole without reconstruction. Unfortunately, some still encounter pressure from well-meaning healthcare providers who assume every woman wants breasts restored. This is simply not true. Every survivor's emotional relationship with her body is unique. Some feel liberated by flat closure, enjoying freedom of movement and no concerns about implant maintenance. Others find deep satisfaction in reconstruction. The key is to advocate for yourself. Ask questions, seek second opinions if needed, and remember that your choice is valid regardless of what others might expect. Take time to visualize your life 6 months, 1 year, and 5 years down the road. Consider your activity level, clothing preferences, intimate relationships, and how you want to feel in your own skin. These personal factors matter just as much as the medical data. Another piece of reassuring news that surprises many women is what the incision actually looks like once the initial bandages come off. The surgical site is not the bloody, dramatic scene that some people fear. Skilled surgeons take great pride in creating clean, precise incisions designed to heal as neatly as possible. You may feel emotional when you first see the changes to your body, and it is normal to feel a wave of discomfort or even squeamishness. That reaction is human, but the area itself is carefully managed, and the appearance is far less alarming than many anticipate. Knowing this ahead of time can reduce anxiety in those first vulnerable days after surgery. Along with the incision itself come surgical drains, often called JP drains. These are essential for most mastectomy procedures and typically remain in place for up to 2 weeks. They are positioned on the sides of the chest and collect seroma fluid that naturally accumulates as your body heals. Removing this fluid is crucial because it prevents pressure on the incision, reduces swelling, and lowers the chance of infection or delayed healing. What many women do not realize is that the fluid's appearance changes predictably over time, and this change actually reflects your body's healing progress. In the beginning, the fluid tends to look bloody or reddish. As inflammation decreases and healing advances, it shifts to a lighter pink, and eventually becomes pale yellow or clear. Watching these gradual changes can be strangely comforting because they serve as visible signs that your body is doing the hard work of recovery. Let me expand on the journey home from the hospital, because this short trip can be surprisingly challenging if you are not prepared. Right after surgery, you will be sore, and even small movements can feel magnified. Many women underestimate how every bump, pothole, or sudden stop on the road will translate into discomfort in the chest area. The driver, even a loving spouse or family member, simply will not feel what you are feeling. To make the ride smoother, plan the route in advance. Choose roads with fewer imperfections, even if the drive takes a few extra minutes. For me personally, avoiding the main bumpy street near my home made a tremendous difference during recovery. Additionally, hold a soft pillow, folded blanket, or coat gently but firmly against your chest. This slight supportive pressure can cushion movement and reduce pain significantly. These small adjustments transform what could be a miserable ride into a much more tolerable one. Once you are home, rest becomes your primary job. Sleeping after a mastectomy presents its own set of hurdles. If you are someone who normally sleeps on your stomach or side, you may worry about how you will ever rest comfortably again. The incisions and drains make those positions difficult or impossible for weeks. Most women end up sleeping on their back in a slightly elevated position. This can be achieved with a recliner, an adjustable hospital bed at home, or a careful arrangement of multiple pillows. It may take a few nights to adjust, but your body will adapt because it needs quality sleep to heal. Many women discover they sleep surprisingly well once they accept the new position and create a supportive setup with plenty of pillows to keep everything stable. Here is something rarely discussed openly. Your armpits may develop a strange, almost cheesy or unpleasant odor in the early days. Because you will likely keep your arms close to your body to protect the surgical sites, air circulation is limited. Sweat and bacteria can build up, creating that noticeable smell. It is harmless but can feel embarrassing or uncomfortable. Gentle cleaning helps. You do not need to lift your arm high. Simply slide a damp, flattened washcloth between your arm and body to freshen the area. Later, when your surgeon approves, a spray deodorant can be convenient because it requires no rubbing or pressure. One of my clients described the odor as reminiscent of blue cheese and found it quite bothersome until she established a gentle daily cleaning routine. Little practical solutions like this prevent minor annoyances from becoming bigger sources of stress. It is also important to understand that a mastectomy is rarely just one operation. If you choose reconstruction with implants, you may have the initial mastectomy surgery, a second procedure to place the permanent implants, and possibly additional surgeries for adjustments, symmetry, or revisions. Some women undergo multiple touch-up procedures over time. Knowing this ahead helps you set realistic expectations about your overall timeline and recovery commitments. Flat closure or deep flap each come with their own surgical considerations and healing demands. Discuss the full picture with your plastic surgeon so you can plan your life, work, and support system accordingly. Pain management is a major concern for almost every woman facing mastectomy, and rightfully so. Surgeons often use long-acting injectable pain relief directly at the surgical site that can provide comfort for the first day or two. Oral medications then take over for the following days and weeks. The important thing to remember is staying ahead of the pain rather than waiting until it becomes severe. Equally critical is addressing the side effects of those pain medications. Most opioid-based painkillers cause significant constipation. When you are already dealing with limited mobility after surgery, constipation can quickly become miserable and even delay healing. Ask your doctor to prescribe a stool softener or gentle laxative at the same time as the pain medication. Over-the-counter options like Senocot, Docusate, or Miralax can make a world of difference. Do not wait until you are uncomfortable to start them. Preventing this issue is far easier than treating it later. The day your drains are removed is often one that patients look forward to with great anticipation. Those drains can feel awkward and limiting. However, the removal process itself can cause a tugging or uncomfortable sensation for some women, sometimes even brief pain. It helps to know this is normal and usually short-lived. Most patients feel immediate relief once the drains are out, even if the moment of removal is not entirely pleasant. Your care team will guide you through it and provide instructions for monitoring the sites afterward. Returning to work is another common question. The timeline varies greatly depending on the type of job you have and how your body heals. For those with desk jobs that involve minimal physical activity, many women feel ready to return part-time around 2 to 3 weeks, provided they have good support at home. Jobs that require lifting, reaching overhead, or being on your feet for long periods may need 6 weeks or longer before clearance. Listen to your body rather than pushing a rigid schedule. Fatigue can linger, and emotional processing takes energy too. Giving yourself permission to heal at your own pace is an act of self-compassion. One of the longest-lasting concerns for many women involves the appearance of scars. The good news is that there are proven strategies that can dramatically improve how scars look and feel over time. Once your surgeon confirms the incisions are ready, focus on 3 key approaches. First, keep the area well moisturized. Apply gentle, fragrance-free lotions or oils multiple times a day. Some evidence supports vitamin E in helping with scar healing and appearance, but consistency matters most. Moisturizing prevents tightness and supports skin elasticity. Second, commit to regular scar massage. This is one of the most powerful things you can do. Spend 20 minutes twice daily gently massaging the scar and surrounding tissue in all directions, up and down, side to side, and in circles. This breaks down excessive scar tissue, improves blood flow, increases flexibility, and reduces sensitivity. I have seen dramatic results in my own patients and even in my personal experience with a long abdominal scar. What once felt thick and restrictive became soft and barely noticeable with dedicated massage. It requires patience, but the payoff is worth every session. Third, consider silicone-based products. Silicone sheets or gel create an optimal healing environment by hydrating the scar and protecting it from outside irritation. Sheets can be worn overnight for extended contact time, which research shows helps reduce redness, thickness, and raised appearance. High-quality medical-grade options designed for post-mastectomy use are available and represent a worthwhile investment in your long-term comfort and confidence. Beyond the physical aspects, remember that a mastectomy is only one chapter in your larger cancer story. True healing involves nurturing your whole self, body, mind, and spirit. Focus on nutrition that supports recovery and reduces inflammation. Stay gently active as soon as your doctor approves movement. Build a strong support network of people who truly listen. Consider speaking with a therapist who understands cancer-related experiences. Many women find renewed strength and clarity after this journey. They discover resilience they never knew they possessed and often develop a deeper appreciation for life's simple joys. Preparation, realistic expectations, and practical strategies can transform fear into manageable steps forward. You are not alone in this. Thousands of women have walked this path before you and emerged stronger, wiser, and often more connected to what truly matters. Advocate for yourself, ask every question that comes to mind, rest when your body signals the need, and celebrate small victories along the way. Whether you choose reconstruction or flat closure, whether your scars fade to faint lines or remain visible reminders of survival, you are still you, beautiful, worthy, and capable of a full and meaningful life ahead. My hope is that these insights help ease some of the uncertainty you may be feeling right now. Arm yourself with information, surround yourself with compassionate care, and trust that your body has an incredible capacity to heal. You have already shown strength by seeking knowledge and considering your options thoughtfully. Keep moving forward, one day at a time. Healing is not always linear, but it is absolutely possible. You deserve support, information, and the very best chance at a smooth recovery and vibrant life beyond cancer. Word count approximately 3120.